When you come into hospital for a local anaesthetic procedure, you'll often be asked to walk to the operating theatre yourself in a hospital gown with hospital slippers. Some patients will go down on a wheelchair or on a trolley. When you get to the anaesthetic room, I'll put in the local anaesthetic. We do some standard checks. The World Health Organization has a series of checks that we have to do on a checklist, and we'll work through that. The nurses will receive you, work through the checklist, and then we'll put the local anaesthetic in. And when that's working, we'll take you into the operating room. We'll check the operative site to make sure that that's completely numb before we go ahead with the surgery. And then when that's all working nicely, we'll go ahead with the operation, which will involve preparing your limb with antiseptic, putting it out on an arm board, putting some sterile drapes around it, and often blowing up a tourniquet, which is uncomfortable. We leave that to the last minute, and then we'll proceed with the surgery when we're confident that the area is fully numb. Some patients, when given the choice of a regional block, that is to have an injection in the armpit or in the neck to make the whole arm numb for 36 hours, would entertain the prospect of looking after their arm for 36 hours in order to avoid a general anaesthetic. You will expect to have to look after your arm until lunchtime or late afternoon the following day. The arm will feel like it belongs to somebody else. You won't be able to feel it or move it at all. You have to carry it around, you have to put it on some cushions, you have to rest it on the back of the sofa, and you have to look after it to make sure it doesn't get squashed or injured during the 24 hours after the surgery. You can expect the feeling to come back to your arm after a regional block, usually sometime during the afternoon following the surgery the next day. If you're coming in for a general anaesthetic, you'll see the anaesthetist on the ward before you go down to the operating theatre. And then when you get to the operating theatre, you'll be received by the anaesthetist and the assistant, and then the WHO, the World Health Authority, checklist will be run through once again. And once that's done, the anaesthetist will then put a drip needle in your arm and give you the injection to put you off to sleep. For a general anaesthetic, you will have needed to be starving for 6 hours, but you can have water for 2 hours, up to 2 hours before the surgery. For a local anaesthetic procedure, you don't need to starve before the surgery. You don't need to miss any meals, and you can take your normal medication before having a local anaesthetic procedure as a day case. We're quite keen to make sure that everybody has an escort to take them home, because going home alone after a surgery like this is not advisable. Many patients might feel faint in a taxi or on a train or on a bus, and after a general anaesthetic, patients feel quite drunk, and it's clearly inappropriate to wander around London in that sort of state. If you've had a local anaesthetic, surprisingly, patients often feel faint as well, and it's advisable to have somebody take you home.